Governor Mike DeWine says the surge in cases is a cautionary tale. Thank you, everybody, for staying with us on this Monday at 5 o'clock. I'm Darlene Hill.
And I'm Brad Johansson. Ohio doing a lot more testing, but the governor says that is not why the state's numbers are going up. Here's NBC4's Adrian Robbins live at the State House tonight with why he says the jury is still out on Ohio's future with this pandemic.
Well, Brad, we know states like Texas, Florida, and Arizona are seeing a surge in their coronavirus cases, but Governor Mike DeWine today is telling Ohioans to pay attention because Ohio's numbers are going up as well. That includes the coronavirus case numbers as well as the hospitalizations of those affected with the virus. Now, Ohio is specifically seeing problems in the Cincinnati and Dayton areas. The alarming numbers are linked to community spread, and were even called out on the weekly governor's call with the vice president. But Governor DeWine is urging all Ohioans everywhere to wear masks and continue to social distance.
We control our future. We do not want our future to be what we're seeing in Texas. We do not want our future to be what we're seeing in Florida. We can control it. We determine what this thing is going to look like in 2 or 3 weeks by what we do today.
Now, although Ohio is seeing its coronavirus case numbers go up, the governor did announce today that starting on July 20th, outdoor visitation at nursing homes will be able to start with safety precautions put in place. Local for you at the State House, I'm Adrian Robbins, NBC4.
Adrian, thanks so much. Tonight, new figures related to the spread of the virus here in Columbus.
Yeah, NBC4's Dan Perlman spoke with the city's health commissioner today, and he joins us now live with why she is concerned about the number of positive tests going on right now among people living in Columbus. Dan.
Well, Darlene and Brad, she's concerned because in the last several days we've seen a significant rise in the number of positive cases, and she is not alone in that position. 7 here is autoimmune compromised, as is a close relative.
So it's hard, because I want to be able to see her, but I also don't want to, possibly give her the virus.
That is why the new figures from Columbus Public Health are alarming.
It's terrifying.
In just the last 4 days, Dr. Mashika Roberts tells me the health district has seen a nearly 50% increase in the number of positive COVID-19 cases.
We know we're doing more testing, but the increase in testing doesn't correspond with the increase in cases that we're seeing.
The majority of those cases, according to Dr. Roberts, are in relatively young adults, those between the ages of 20 and 39. That alone one of many reasons for her concern.
But when we think of the young and healthy, it shows us that anyone can get this virus. And this age group in particular looks like they're not as vulnerable, so we're not seeing the hospitalizations, but we know that they can spread it to individuals who are vulnerable, which could cause a surge in our hospital utilization.
Every Monday, Dr. Roberts checks with the heads of our 4 hospital systems. As Governor DeWine also stated, she told me they are not at capacity, but that's something she's watching closely, along with the number of positive tests, which have both her and 7. Hoping more people wear masks, wash their hands, and practice social distancing.
If you don't have to go out, don't go out. If you can stay home, the more, the better.
Now, Columbus Public Health not attributing that spike in cases to any particular reason other than people are socializing more now without following those guidelines to stay safe. Now at 6 o'clock, what Dr. Roberts has to say to you if you're sitting at home right now and you're thinking about getting a test. Local for you in Columbus, Dan Perlman, NBC4.